Hello, everyone. My name is Azadi, and I'm a D3 student at the Dental College of Georgia. Today, I'd love to speak to you all about haunted houses and how they relate to dentistry. No matter where on earth you live, whether you live in the largest town or the smallest one with only one stoplight, it seems like every single town has one abandoned, creepy, old haunted house. No one knows who the owner is. It doesn't seem like anyone ever enters or leaves for that matter. And it always looks creepy, whether it's the middle of the day or the absolute dead of night. It honestly looks like someone took the movie Monster House, a movie where the house literally eats children, and transplanted it into the real world. If I were to give you $100 to walk into that house alone in the middle of the night, I guarantee you very few people would accept that $100. But for some reason, there is something that does motivate people to walk into that haunted house, and that's friends. While you wouldn't have gone alone into that haunted house for the $100, as soon as you have friends there egging you on, making you excited, and pinpointing how this could be a life-changing memory, going into that haunted house no longer seems daunting. Instead, it becomes exciting, fun, and in about 15 minutes after they've started egging you on, you're in that haunted house for sure. In fact, that is the entire premise behind the movie Scooby-Doo. Rumble Raggy, haunted house. So you're probably wondering, what did that bizarre Scooby-Doo impersonation and what on earth do haunted houses have to do with dentistry? Well, people pay thousands and thousands of dollars making their dental office look absolutely pristine. They've got beautiful art on the wall, comfy furniture, maybe a nice plasma screen TV or an aquarium, all in the waiting room, trying to comfort the patient. But for a lot of patients, they're still viewing your beautiful, pristine office as a haunted house. They're terrified of all the instruments that you have in your hand, unsure what any of them do. They don't know what their treatment is going to entail, whether it's one cavity or a full mouth rehabilitation. They have no idea. For many patients, they may have had negative experiences at the dental office, a painful injection, a bad experience, and they may now want to return to dentistry until they've found their way into your office now. Some only coming when they've got serious pain that they need dealt with. And for us, we're always seemingly constantly busy. We barely have time for lunch as we're running for fixed appointments to removable to operative. It seems like it never ever ends. But I have a challenge for all of us as future dentists. Why not take a few minutes out of our time to view things from the lens of our patients? Let's practice empathy, and let's understand why to them the office may seem like a haunted house. It may seem to them that they don't have any friends welcoming them and making sure that they feel like they can conquer this haunted house and make a positive, life-changing memory. With a little bit of sharing your heart, finding about their interests, and a little bit of humor, you can practice that empathy and quite literally change a patient's life. You can watch as their fears subside and instead become joy. They can now find comfort in your voice, in your passion, and in your personal connection with them. An injection no longer feels like a painful needle plunging deep into their oral mucosa, but instead feels like the step that's going to get them out of more pain and make the procedure way easier overall. A large, daunting treatment plan that doesn't seem to make sense now becomes a clear, concise plan towards getting them to more pristine oral health and improving their quality of life. With a little bit of love and a little bit of passion, this haunted house that your office once represented to these patients can instead become a warm, welcoming, and inviting, loving home. Thank you so much.